It's surprising just how simple it can be to improve your health, even when you're older. Simple steps include trying to integrate more movement into your day-to-day life. And I am forever impressed by the way many of my patients really take this advice on board and are able to enact small but significant changes in their day-to-day life to incorporate more physical activity. So many people think it's too late to start changes in behaviour, they can't improve their health, and they also lack motivation. Taking that first step can really be a significant challenge, but it's achievable. So it's a matter of stopping and thinking and saying, I'm going to give it a go.
I never knew a soul. I just popped up one day and there was flyers on the table. So I picked it up and I thought, well, I'll go and try it. Nobody's going to come knocking on your door. So you have to make the first move.
Well, I seen their sign and I thought, well, those girls look like they're having so much fun and I love the water and that, so I just approached them and asked if I could join, and they said everyone's welcome.
There are lots of suggestions out there about how older adults can stay active. Some of the ways are as easy as learning how to do home exercises. Some are attending groups. Some of them are just going for a walk. The Australian guidelines on physical activity for older people suggest that you need to do at least 30 minutes of moderate intensity exercise every day or most days of the week. And basically it is exercise that you can talk while you're doing it, but you can't sing. So you don't want to be huffing and puffing so you can't get your breath in, but you want to be doing something that actually makes your heart beat a little bit faster and helps with your heart disease problems, diabetes, and all those other sorts of health issues that older people tend to get. One of the things that we know about people who, as they age, is that they start to lose strength. So it's important that we think about what it is we want to do each day and how we're going to keep those muscles strong enough to be able to do everyday tasks. So if you're a keen gardener and you want to be able to pull out the weeds or dig holes to put plants in the ground or whatever else, you need to keep the muscles that are relevant to that task strong enough to be able to do them.
I used to get a lot more tired. You do get you get toned up for gardening. You're doing lots of different movements and stuff like that. So yeah, no, there's definitely exercise involved.
Gardening, you can do it by yourself without bother the other things. So that's why exercise and gardening actually is really good for the elderly people.
It's usually good to have a goal when you start to do some sort of physical activity. So you may want to be able to climb on the local bus so you can go and visit your friend. But you need to do exercises that are going to increase your leg strength to be able to climb up onto that bus. Or the exercises that are going to increase your leg strength so you can go for a walk. There are lots of different exercise options out there about exercises that you can do by yourself. There's also lots of classes out there in all kinds of organisational halls. One of the places you can look for those options is going onto the Active and Healthy website. And if you put in your postcode, you can find exercise programs that are suited to seniors or people over 65 within 5, 10 or 15 kilometres of your home.
Well, I do come to the exercise group here at the centre every week, and because I live so handy, I come over and it's been wonderful.
What you see in our community these days is that lots of people are using their parks and streets as exercise options, and older persons' gyms. And there are lots of people who do exercises in parks every day.
We practice every week. You know, we really have classes with the instructor, Pat.
But once I've found Tai Chi, I never look for an excuse. I really enjoy it, and I enjoy the type of people who are attracted to it too.
Talk to your GP about how to move more. Visit the Active and Healthy website to find a program near you. South Eastern Sydney Local Health District acknowledges the support of all community members, organisations, groups and local councils that made this video possible.